Assalamu alaikum. This is Shamama Batul Mughal, roll number BP1650206. The topic which was assigned to me was hepatitis A vaccine. But first of all, we will see basically what is hepatitis A. Hepatitis A is a vaccine preventable liver infection caused by the hepatitis A virus. The hepatitis A virus can be found in the stool and blood of people who are infected, and it is a very contagious disease. It is spread when someone unknowingly ingests the virus, even in microscopic amounts. Through close personal contact with an infected person or through eating contaminated food or drink, we can easily get hepatitis A virus. Mechanism of action. Administration of hepatitis A vaccine causes an immune reaction by activation of white blood cells that fight infection. Immune cells simply engulf the vaccine antigen and release inflammatory mediators to signal the B and T cells to activate and proliferate to attack the antigen. The two types of lymphocytes, which are the B and T cells, are triggered to differentiate into new cells with a specific activity against hepatitis A antigen. The cells include antibody producing B cells, memory cells, cytotoxic and helper T cells, which give a prolonged immunity if exposed to the actual pathologic viral antigen again. Now, the rational use. Hepatitis A vaccine can easily prevent hepatitis A. Most adults with hepatitis A have symptoms including fatigue, low appetite, stomach pain, nausea, jaundice. But in children less than 6 years of age, we do not have any symptoms. Hepatitis A vaccine has made this disease much less common in Pakistan. However, outbreaks of hepatitis A among unvaccinated people still happen. The common side effects. After administration of vaccine, there could be swelling, tenderness, redness, low fever, general ill feeling, nausea, loss of appetite, headache, and finally the dose adjustments. Children need two doses of hepatitis A vaccine. The first dose is 12 to 23 months of age, and the second dose at least 6 months after the first dose. Older children and adolescents 2 to 18 years of age who were not vaccinated previously should be vaccinated. For the primary immunization, 0.5 ml intramuscular injection in the thigh muscle at 0, 1 and 6 months. Adults. Adults who were not vaccinated previously and want to be protected against hepatitis A can also get the vaccine. For the primary immunization, 1 ml intramuscular injection in the deltoid area at 0, 1 and 6 months, and alternatively a 4-dose schedule given on days 0, 7, 21 to 30 followed by a booster at month 12 may be used. Travelers are advised to get vaccinated at least 2 weeks before traveling. For the renal dose adjustments and the liver dose adjustments, there are not any recommended dose adjustments. Drug interaction and toxicity. People with a weak immune system may not fully benefit from the vaccines. Basically, the cancer patients receiving treatment with anti-cancer medications and those taking the immunosuppressant medication should ask their doctor or pharmacist if the hepatitis A vaccine is right for them or not. The drug toxicity studies have not reported any vaccine overdoses of the hepatitis A vaccine. There has been researching into the aluminum adjuvant added to hepatitis A virus. Pakistani drug brand. The first brand is a Vaxim, and it is a injection 160 units basically that are administered, and the manufacturer is the Sanofi Aventis Pakistan Limited. The second brand is Havrix, that is the 720 LSI units per ml, and it is also injectable suspension for the intramuscular use, manufactured by GlaxoSmithKline, and there are no such alternatives available of hepatitis A vaccine in Pakistani market. Irrational use. When prescribing hepatitis A vaccine, it should be noted that people who have ever had a life threatening allergic reactions to the hepatitis A vaccine, or who are known to be allergic to any part of the hepatitis A vaccine, should not receive the vaccine. Also, the vaccine is not licensed for use in infants under age 1 year. Now, the case study. Patient A is 19 years of age and a college sophomore who presented to her physician's office with a mild jaundice. The patient reports being in good health until a week before, at which time she began having flu-like symptoms of headache, low-grade fever, nausea, loss of appetite, and malaise. She self-treated with fever with acetaminophen. The symptoms persisted. Upon awakening this morning, she noticed that her eyes were yellow. She therefore contacted her physician's office. In response to her physician's question, she indicated that her urine has been darker than usual and she has been experiencing joint pain for the last 3 days. She also acknowledged that her stools have been lighter than usual. Her medical history is positive for mild exercise induced asthma, for which she uses a prophylactic bronchodilating inhaler. Her only other routine medication is a daily vitamin mineral supplement. She reports no surgeries. Family history is positive for the cardiovascular disease, and other significant history includes that she was immunized against hepatitis B at 12 years of age, and she recently participated in a 2-week mission trip to Central America. Although she was very cautious about the food she ingested during the mission trip, the patient indicated that a primary recreational activity after the day's work was to swim in the lagoon near the village. The lagoon was fed both by a stream in which the natives washed their clothes and the adjacent bay. Rainfall averaged 2 to 3 inches per day. Patient A returned to the United States 5 weeks ago. Physical examination revealed a well-developed, well-nourished female who was alert and oriented. Her temperature was 99.7 Fahrenheit. Other vital signs were within normal limits. Abnormal physical findings include mild icterus of sclera and skin, abdominal tenderness, hepatomegaly, and palpable spleen. Results of laboratory are indicated in Table 1. Here you can see in table 1 the lab findings of the patient A, and now the soap notes. Subjective. Chief complaints: mild jaundice, having flu-like symptoms of headache, low-grade fever, nausea, loss of appetite, and malaise. Age 19 years, gender female, history of patient positive for mild exercise induced asthma, family history is positive for cardiovascular disease father and both sets of grandparents, and breast cancer mother. Current medication self treated the fever with acetaminophen. Objective. Vital signs were that she was well developed, well nourished female, temperature was 99.7 Fahrenheit, lab findings can be seen through chart. Assessment. Patient A has presented with classical signs and symptoms of acute hepatitis. Based on her past history, travel, and exposure history, the most likely diagnosis is acute hepatitis A infection. The hepatic chemistry profile and serologic studies confirm these diagnoses. Exposure probably resulted from accidental ingestion of contaminated water while swimming in the lagoon. Hepatitis A virus is a reportable disease. Because acute viral hepatitis is usually a self limited disease and patient A is alert with no evidence of coagulopathy, she can be managed as an outpatient with close follow up. Plan. Pharmacological treatment. A single dose of HAV immunoglobulin is recommended for close contacts. If immunoglobulin is not available, administration of hepatitis A vaccine may prevent illness or lessen the severity of the contact symptom if infection does occur. Liver enzymes and prothrombin should be monitored every 5 to 7 days for the first 2 weeks. Then, if convalescence is satisfactory at 14-day intervals until function test results have returned to normal, because acetaminophen can be toxic to the liver, ibuprofen would be a better alternative for controlling fever. Non-pharmacological treatment. Bed rest is not indicated, but the patient should avoid strenuous activity. She should eat a well balanced diet and abstain from alcohol for the duration of the illness. If nausea precludes the patient from ingesting food and fluids, IV replacements of fluid and electrolytes may be necessary. So, here is the soap notes. The references are mentioned. Thank you.